Good afternoon, everyone, and thank you all for being here on short notice. As you know, we are fortunate there are no confirmed cases of COVID-19 coronavirus here in Philadelphia as of right now. But with the governor's announcement this morning of 2 presumptive confirmed cases in the state, we felt it prudent to reassure residents here of the city's preparedness. As you will hear shortly, even with this afternoon's announcement, we believe the risk to Philadelphians is low. But all residents need to take proper precautions, as our health commissioner, Dr. Tom Farley, will spell out shortly. We're monitoring the situation with our state, regional, and local partners and receiving and distributing CDC guidance. We regularly work with our hospital and healthcare community to prepare for this type of situation, so we're confident that if we get a case, our response will be ready and appropriate. With that, I'd like to turn it over to Managing Director Brian Abernathy.
Thank you, Mayor. I wanted to just take a quick opportunity to say thank you to all of our partners who are here today. Certainly the school district, the Convention and Visitors Bureau, Visit Philly, City Council, and all of our internal operating departments. We have all been working very hard to make sure that the Philadelphia is prepared and feel very confident that we are ready for what this virus may throw at us. I'm going to turn it over now to the experts to walk through, and certainly we'll be back for questions as we go. Dr. Farley?
Thank you all for coming. The first thing I want to say is that the situation is changing very rapidly, and our response is changing rapidly. So I'm going to give you our perspective on what's happening today. That's going to be changing in the future, and so you need to keep up with those changes. As the mayor said, the current situation is that there are no identified cases of coronavirus, COVID-19, in Philadelphia. However, it is our expectation that we will likely have cases at some point. If this infection were to spread widely, there was a risk that more people will become sick, and there's a risk of social disruption from the disease itself and from our response. But if we respond quickly, and if we work cooperatively, and follow through on the basic public health approaches, we can limit the spread and protect Philadelphia's residents. That's what we're here to talk about. Before I get into our response, I want to give you a little bit of background so everyone understands, sort of as a baseline, of the situation we're addressing. If you look at the slide screen here, that's what the virus looks like under a microscope. What is coronavirus? Coronavirus is actually a large family of viruses that we all have experience with. Many different coronaviruses cause a cold that we would tend to get every year. However, there have been 2 severe coronaviruses that have emerged in the world in the last dozen years, both of which are now contained. One was called severe acute respiratory syndrome, or SARS, that arose in 2003. And there was another one called Middle East Respiratory Syndrome, or MERS. Both of these had high case fatality rates, but both of these have been contained by public health efforts. The illness caused by the COVID-19 coronavirus is something we now have experience with. There is an incubation period, that is a time between when people are exposed and when they develop symptoms, of between 3 to 6 days, with a range of perhaps 2 to 14 days. The most common symptoms of this infection are a fever and a dry cough, and then that can progress to difficulty breathing. The elderly, smokers, and people with chronic diseases are at greater risk for having more severe illness. So how is this virus spread? Based on our experience with past coronaviruses, we feel it's because when an ill person coughs or sneezes, and that puts out fine droplets into the air around that person, and then that is breathed in by somebody nearby. Or if that person who is ill has secretions, like nasal secretions, that another person nearby comes in contact with, that could also spread the infection. This usually requires close contact. By close, I mean within 6 feet. This provides an opportunity for us to limit the spread of the infection. The people who are most at risk for acquiring infection would be healthcare workers, because they tend to work very closely with people who are sick, of course, and then the family members and close household contacts of people who are sick. People who have much more casual contact, who have much shorter duration exposure or more distant exposure, are going to be at much less risk. So why is it that we are talking about this so much right now? We know that this infection emerged in China in late December, but what's happening now is that it's spread to many more countries around the world. This is data from the World Health Organization of the number of new cases identified per day around the world, and as you can see, it's rising very rapidly, and it's across really all continents at this point. So how are we going to address this problem when it comes to Philadelphia? This is the key elements of the strategy really have to do with containment of the virus. There are 4 steps to that. First is rapid identification of cases. The quicker we can identify cases, the less opportunity they have to spread that infection to others. Second is then isolation of those cases once we have them identified. If they're not near people, they're not going to be spreading infection to others. That's isolation. Then it's identification of people who have already come in contact with people who have this infection and who may have already then been infected by the person who had the illness. And then finally, quarantine. That's a term we use for people who don't have the symptoms of the illness but may develop it. Quarantine of those close contacts for 14 days. When I say quarantine here, for the most part, this is simply, in a sense, self-quarantine. People staying at home under public health supervision so that we are sure that they don't come in contact with additional people if they were to develop this illness themselves. If we can execute on this strategy, then we can contain this virus. And so it's delivery of this that matters the most. Now, there are potentially broader elements to this strategy which are possible in the future but are not needed now. The broader elements are limiting public gatherings so that if someone who was unrecognized got sick, can't expose many people at one time, and other steps to do what we call social distancing, to make it so fewer people are close together so there's less spread from one person to another. Again, thus, we're not recommending that now. We believe that this strategy is the key to it, and that's what we're going to be putting our greatest emphasis on. Now, experience says that if we do this and we deliver on that strategy, that this virus can be contained. Why do I say that? Because of evidence we have around the world. This is the number of new cases by day in China based upon the reports that come out from the World Health Organization. As you can see, in early February, China peaked at about 4,000 cases per day. They have scaled up the response I just showed you at a very large scale, and through that they've had a huge decline in the number of new cases per day. They're getting now about 100 cases per day. Similarly, the country that has had the greatest number of cases beyond China is South Korea. This is the number of new cases they're having per day. They likewise have scaled up that similar response using those same elements of containment, and it appears to be turning around in Korea now, at least at this point. So we are, and will continue to be working with hospitals and clinics and doctors and health plans and others to execute that strategy. And we're doing that in close coordination with the Centers for Disease Control, who we work with on a routine basis, and the State Health Department. Now, putting this strategy in place is changing day by day. As of today, the testing for the coronavirus is much more available than it was even yesterday. In the past, this testing was only available through the Centers for Disease Control. It's now available at the State Public Health Laboratory, and 2 commercial laboratories have made it available, LabCorp and Quest, which means that any physician in the city can send a test and have that test be performed. So here's what Philadelphia residents need to know. First, they need to be aware of what the symptoms are that this might cause so that they can be rapidly identified if they were to develop this problem. The 2 most common symptoms of this are fever and a dry cough. The most common symptom is not a runny nose. This is not a cold. Okay, this is an infection of the lung that causes a fever and a dry cough. If people have those symptoms, the first thing they should do is stay away from others. Whether that infection that they have is caused by the coronavirus or anything else, we want them to stay away from others so they don't pass the infection on to others. If they have that combination of symptoms and some sort of history of exposure to the virus or potential exposure to the virus, then we would recommend that they get tested. Exposure to the virus means travel to an affected area or close contact with somebody who is thought to possibly have the coronavirus infection by public health authorities. Not just someone who thinks, well, maybe I have it, but there's some evidence for public health authorities that someone that they came in contact with may have this infection. The 2 cases that you've heard about today that occurred in Pennsylvania both met this criteria, okay? It's this combination of the symptoms and the exposure history. Now, the Philadelphia Department of Health is working right now with doctors to get the system in place. When a case is identified, we will be notified immediately. We will have staff then contact the patient to follow through on all the additional steps, to isolate the patient, to identify the contacts, and to have the contacts be in quarantine. Now, I should say this is all being put in place as we speak. It's changing day by day. There will be bumps in this in the first few days. It will get better each day. Finally, let me say, This is a time when many people are worried about this. It's a difficult period, and there may be difficult times ahead. But we have responded to many other public health challenges and ultimately succeeded over them. We are certainly doing everything we can. We have good science behind our response right now, and I'm confident that we will overcome this challenge as well. I'll be happy to answer questions, but first I'm going to turn it back to Managing Director Brian Abernathy.
Thank you, Dr. Farley. Our response to a potential sickness is specifically being coordinated by our Office of Emergency Management, where we are looking at not just the public health, but also the operations of our city departments and being able to make sure that we are being able to maintain city services going forward. And with that, I'd like to introduce our Deputy for Emergency Management, Ziegler.
Good afternoon, everyone. Thank you, Brian. So yes, thus far, the Office of Emergency Management has been coordinating closely with our partners at the Health Department and other city agencies to make sure the city is prepared in the event that we do get cases here. So what has that meant so far? We're working with other city agencies to make sure that the city's continuity of operations plans are up to date in the event that we are missing some of our workforce due to illness. We're also coordinating closely with state and regional and national partners to make sure we have the latest information on things like supply chain disruptions and other possible considerations that we could see here if the virus comes. We are prepared to activate the City Emergency Operations Center. It's not activated at this time, but should the situation escalate, we are prepared to do that, bringing together lots of different city partners and also external partners as well to make sure that we have a coordinated response effort and be able to deliver the services that the city needs. So we've built relationships through many years through trainings and exercises and collaborative planning efforts, and the results of all of those efforts are what we're seeing today. We're confident that we'll be able to continue to support the health department and the city response as we go forward. So, thank you.
Great. Thank you, Derek. Obviously, one of the places where we are always in close contact with one another is on our regional rail, our buses, and our public transit. We appreciate the partnership that Leslie Richards, as our general manager, provides, and welcome Jim Fox to talk through what actions they're taking.
Thank you, Brian. Good afternoon. Well, first thing I wanted to say is that SEPTA is open for business. It is safe to continue to take our service, and we will continue to run our regular service as we see how this thing evolves. In addition, I'm happy to say we continue to participate and involve ourselves in collaborative calls on a regular basis with not only our local stakeholders and partners, as you see here, but also in the statewide level, and we're continuing to have national interactions with all our peer agencies so we can make sure that we're all managing this the same way. To that end, the first thing that we're working on at SEPTA is our operational readiness. We're watching how this situation affects the region and the local personnel and citizens, and as that resolves, we determine how we are going to manage our service, whether we're going to reduce service, eliminate service. It's all going to be a fluid situation, but we have plans in place, no different than what we do for weather events or special events, on how we can manage and alter our service based on what's thrown at us. Additionally, cleaning is no new issue to SEPTA. We have historically had a very robust cleaning program. We deal with the management of spreading of germs on a regular basis. Even before the situation took place, SEPTA has always had a regular daily extensive cleaning process, both within our stations and our vehicles. But to that end, we're also increasing that cleaning as we now have to deal with the current situation at hand. We are going to see our employees on a regular basis go out on a normal cleaning schedule, but in between that cleaning schedule, we'll have individuals going out and periodically hitting our high-touch surface areas, both at our stations and on our vehicles, just to try to manage and minimize the spread. We also ask, while we're doing our part, that our riders and the citizens do their part and continue to follow all the great guidance that's out there for practicing good hygiene practices. Respect your fellow rider. Remember not to be coughing and sneezing on everybody. Continue to keep your hands clean and watch how many surfaces you touch and try to minimize the spread of this and any kind of germs. It's good practice regardless of whether it's corona or any type of germs. We continue to also have good communication with our employees and to our riders. For our employees, we have an internal website that we continue to update our employees on so that they can keep abreast of all the different situations at hand and what we expect from them. And for our riders, SEPTA on our homepage now has a link on our homepage for the COVID-19. We will continue to update riders and our general public on things that are happening on our system, what we might need them to do. And as the doctor said, this is a fluid situation changing every day. So continue to have the public continue to look at our website, and as information is deemed to be something we want to communicate, we'll use our website as the main source of communication to our riders. Thank you.
That's okay. The gateway to Philadelphia for many is our airport, and certainly our international travelers are coming through Philadelphia's own airport, and would like Chellie to come up and talk through their preparation as well.
Thank you, and good afternoon, everyone. At Philadelphia International Airport, it is our top priority to make sure that folks who are traveling through our facility remain safe. We are also very concerned about the safety of our employees, and so I'm going to talk a little bit today about a couple of the actions that we have taken to make sure that safety remains at our airport. First, our team has a communicable disease emergency response plan that has been coordinated with our airport partners, including the airlines, the CDC, the TSA, Customs and Border Protection, and Public Health Department professionals. This response plan allows us to respond to communicable diseases identified on international and domestic flights, as well as in the community. We are collaborating with all stakeholders frequently to make sure that as this situation changes, we are able to respond appropriately. Additionally, we have stepped up our cleaning and disinfecting procedures to include the use of Envirox Critical Care, which is a highly potent disinfectant formulated for critical disease transfer points. We are using this chemical on high-touch surfaces, such as handrails for steps, escalators, moving sidewalks, elevators, handles, buttons, floors, and restrooms. In order to reduce the number of passengers touching common areas, I also want to note that we have proactively installed touchless devices in our restrooms, so think faucets, soap dispensers, towel dispensers, and toilets. Also throughout our facility, we have almost 50 water bottle filling stations that are touchless as well. We will continue to support all of our partners here in the room to make sure, again, that our passengers, our guests, and our employees stay safe, and you can visit phl.org/COVID-19 to see the latest updates at the airport. Thanks.
Thank you, Chellie. Before we take questions, I do want to recognize Council Members Green and Council Member Bass, and invite Council Member Bass, as chair of our the Council's Committee on Public Health, to the podium.
Good afternoon, everyone. Listen, this is the city of Philadelphia. We know how to manage. We know how to manage when it comes to large events or crises. And I think that, the first thing I want to say is thank you so much to the mayor, to the health commissioner, to SEPTA, to the airport, to all of the partners, and of course the Office of Emergency Management, to all of the partners who came together and got in front of this to make sure that folks understand what's happening, to know the symptoms, to know the signs, and to know what we need to look out for and be responsible as we conduct ourselves and go about business as we normally would. So I just want to thank them. Know that you have a very interested party, a very cooperative party in City Council, and that we stand here to be a part of the solution and work with all the parties that are making this happen. So thank you so much. Derek?
Yeah, I would like to thank the administration and all the partners here for the work they're doing and really providing information to the public about what's going on with COVID-19. In my role as a member of City Council, but also as a board member for the National League of Cities, I've been reaching out to some of our member cities about the actions they're taking, and to the extent that we have information that could be helpful for the city of Philadelphia, I will make sure I communicate that information to the mayor, Brian Abernathy, and all the partners that are here today. Thank you.
Thank you. We're going to open the floor up to questions. Yes, ma'am.
Yeah, first, let me just say one thing I neglected to say earlier, and that is that the health department has a website that is updating constantly with guidance for all sorts of institutions and for residents of the city. It's www.phila.gov/COVID-19, COVID-19. There is information there about facilities, what they can do. We have lots of experience in the past in working with nursing homes around prevention of influenza transmission in nursing homes, which is a problem every year around this time. And we will be working with them about things such limiting visitors, particularly visitors who are sick should not be attending nursing homes, and steps that nursing homes can do to prevent transmission within the nursing home and for rapid identification of a case if it were to occur. So, as I said earlier, the testing has just become available in the last 24 hours in these 2 commercial laboratories, which means that any physician in the city can send a test to LabCorp or Quest, and the test will be done. If there are situations where it may be difficult for a physician to do this, the state public health laboratory can do a limited number of samples, and we can be a conduit for that. So if people feel that testing is appropriate, according to the criteria I have here, they should contact their doctor. And if the doctor wants to know how to get a test done, the doctor can contact us, and we will be reaching out to doctors about how they do that. You know, I want to be clear, though, that with so many people worried, there may be many people for whom testing is not appropriate. If people are healthy, they shouldn't be tested. If people have a cold, they shouldn't be tested. It's just if they have this combination of symptoms we have there and this history that suggests that they might have been exposed.
Any final questions? Thank you all.